Hey guys, today I'm going to teach you how to read and use a route slip. We use route slips on every single patient that walks through our doors. And I know that they can be a little intimidating and a little bit confusing at first, and I hope this kind of clears up that confusion so that we're able to kind of flow more efficiently, especially when communicating with the front and the back. So let's jump into that. We'll start by reading the front of the route slip. This is what tells us all the information we need to know about the patient. And a quick disclaimer, this is my own personal route slip. This is not the correct information, but it's just for an example. So we'll start in the upper left-hand corner. It tells you what day that they're scheduled for, and typically that's the same day that you have the route slip. It tells you their name, their address, their numbers, their work numbers, all of their personal information to get a hold of them. This tells you what doctor they're seeing, what hygienist they're seeing, so HG means hygienist. What was the first day and last day that they were here, how many years as a patient they've been here, last day of their cleaning, last time that they had x-rays taken, how many missed appointments, when was the last time they missed an appointment, and how many people they've actually referred to our office. Jumping into the middle of the page, this tells all about the insurance information. Are they on their own plan? Are they on their parents' plan? Do they even have insurance? If they don't have insurance, this part of the page will be empty like mine is, and the one next to it will be empty as well. So then you'll ask them if they are on our Just Smiles dental plan. And if they're not, you can always give them some information about it. We have brochures at the front that kind of goes over what we offer in-house. And it's really helpful, especially when the patient is in pain and they need this work done. And since I am on my mom's insurance plan, this part of the page is filled out. It just gives a basic overview of the benefits, what benefits remain for the year, all the different kinds of coverage. And this part of the page is very important for the front desk, especially when doing estimates. The section below the insurance information shows how many people in the family go there, when's their birthday, are they male or female, when was the last time that they visited the dentist, their last cleaning, when is their next cleaning. It just gives you all of that information, so if a patient asks you, hey, when is Johnny's next appointment, you can tell them based off the route slip. And below that, we have appointment information, which tells you when is their appointment date, and typically that's the same day that you have the route slip. What time they're scheduled for, how many minutes are they scheduled for. In this case, it's 80 minutes or 8 units. What provider are they seeing? Are they seeing Dr. Shelley? Are they seeing Dr. Phil? Are they seeing a hygienist? So we know which route slip this goes to. And below the appointment information, we have the procedure list, which indicates what kind of procedures need to be done, whether it be today or in the future. In this case, it looks like all of the treatment is being done the same day. In this example, it looks like we are doing a crown buildup on number 2, a filling on 3, and a buckle on 4. Personally, I always double check the procedure list with the patient, like, hey, we're doing a crown and 2 fillings today. Does that sound right to you? And if they say yes, you can continue to proceed with whatever you were doing. Also, I want to make it very clear that you should always have the route slip in the room all the time. You should always have the route slip on you with your patient. Especially before getting started, the doctors will always double check the route slip before getting started, and if you don't have it in the room, you are unprepared. Lastly, I want to bring your attention to the bottom of the page. Normally, this part of the page would be filled out with some sort of appointment, whether it be another treatment appointment or their next cleaning. In this case, since there is nothing down here and there's no more treatment that needs to be done, we would then ask the patient if they would like to schedule back for a cleaning, and it would tell you the date, who they're seeing, and what appointment is for, which is really helpful. Now that is how to read the front of a route slip, and I know it can be quite overwhelming, especially if this is brand new to you, so I'll break it down very simply. It just tells you all of the information you need to know about your patient that you have. So it tells you their name, their birthday, it tells you their insurance information, and any treatment that they have or need scheduled. And you can just base that off of the front of the route slip. And if you have any questions about anything or something that's confusing to you, just ask one of your teammates. We would be more than happy to help. So let's get into the nitty-gritty on how to use the back of a route slip. Sometimes your route slip is going to look like this. Most of the time it's not going to look as overwhelming, but let's jump into it. So at the very top we have assistant. The assistant is you. It is your initials. You should always have your initials on this. And then which provider you are working with. So Dr. Phil, Dr. Patel, Dr. K, Dr. Shelley, or Dr. Aka. In this case, we're going to do Dr. Shelley. Was your procedure done as scheduled, or was it done with changes? So for this example, since we did a crown, we're going to say it was done with changes. We needed to add a extra, a 1 PA for insurance purposes. So make sure you always write down if you do any additional stuff in the procedures. These first two are kind of like hygiene related. It's just adult fluoride, adult sealants. We have additional agents. We also call wisdom teeth consults WisCons. We have implant consults, ortho consults, continued procedures. Did we do a bite adjustment or an occlusal adjustment? That goes hand in hand with continued procedure. Did we do a post-op or an Invisalign check? For the notes, if we do a continued procedure, make sure we are always writing down what we did in that continued procedure. So let's say a patient came in and their temporary came off. So we will write down continued procedure and remade temp. In this upper left-hand corner is the room number we were working out of today. This is most important, especially when the front desk are doing estimates and they have to go back and find which room the patient's in. Make sure we're writing one tooth per line and that we are writing legibly, no sloppy handwriting. This next section is all about writing down additional treatment that needs done. So if you are in a hygiene exam or you're doing a limited exam and the doctor starts naming off numbers and initials, start writing those down. So we're not going to write out everything. We're not going to write down 10 mesial, incisal, facial, lingual. We're going to write down 10 MIFL. 14, we're not going to write out the word root canal and crown buildup. We're going to write down RCT/CRBU. Let's say number 8 needs a root canal and post and core and crown. We're going to write down RCT / post and core. We're all about abbreviations when it comes to, especially this part. So it's just kind of getting that lingo down. Going back to the root canal part really quick, RCT stands for root canal therapy. So it's not abbreviated wrong, I promise. All right, jumping into writing down what's needed for, let's say, a bridge from 18 to 20. We'll write down 18x20, assuming that there is not a tooth there. And we'll always write with buildups, unless your doctor says otherwise. Do not forget to write down with buildups. Now, let's say that the tooth is severely decayed and it needs extracted and it hasn't been extracted already. We'll write down the tooth that needs extracted, so 19 EXT, and we'll write down the dental code with it. So make sure your doctor tells you which dental code, and most of the time it'll be D72 something. So in this case, we're going to do the most common one, D7210. So it gives the front desk an idea of how to estimate their estimates. Now, right below that, we have watch and teeth. So if a doctor during a dental exam is like watch number 4, you just write down that number. And right below that, we have like the 6-month recall, which is for hygiene exams, new patient hygiene. So if they're a brand new patient and they came in for a limited and they need cleaning, we'll circle that. We also have an Invisalign. Do they need trays? IPR, which is interproximal reduction. Are we double booking on the schedule? And is it with an EFTA? So if you are with Dr. Phil and you're doing an Invisalign exam and he wants them scheduled back for a certain time, it will always be in his EFTA column and you will always double book it. Also wanted to mention that when they receive their first Invisalign, make sure the doctors see it first before scheduling the next appointment. Always, always, always. Typically when we scan for Invisalign, they'll come back in 3 units, 3 weeks for their seat appointment. So that's like a 30-minute appointment. And then the rest of that section is kind of repetitive. So you'll write down their seat appointment, and typically, sometimes it'll be 8 weeks out for 5 units, so just pay attention to that. All right, going back to our treatment. So we wrote down all this treatment, and are we going to do it today, or are we going to schedule back? What treatment are we doing? Referring back to what we have written down, we are going to write down 10, 14, and 8, which is all the upper teeth that need done. Are we doing it today, or are we scheduling back? If we're doing it today, make sure that your room number is filled out. This helps out the front desk know where they're going so that they can present their estimate. If we are scheduling back, make sure you check mark that, and ask your doctor how many units that they want for this. In this case, these are root canals, and typically for one root canal, on average, a doctor will take about 12 units. So just ask your doctor how many units that they want. A unit is 10 minutes. And in this example, we're going to just write down 23. So that'll be 230 minutes. And make sure you put down which provider is going to be doing the treatment. Circle Dr. Shelley, because we have been using her as an example this entire time. And then you would be ready to take them up front. Now, let's say that we're not actually going to do the root canals in office, and we're going to refer out. Who are we referring to? This is Central Ohio Endodontics. This is Dr. Steely, periodontist, oral surgeon, Dr. Marshall, Dr. Brown. So if it's an endodontic case, we would be doing COE, which is Central Ohio Endodontics, root canal specialist. Or let's say we're referring to a different office. So make sure you write down what office it is. We're going to use Elite Dental as an example for the root canal referral. Now let's say that they're in a lot of pain and they need a prescription. So we would also check mark what kind of prescriptions we would be giving them. Augmentin, 875. We have Norco, Medrol dose pack. We have Halcyon. Really quick about Halcyon, it is a oral sedative. If your doctor prescribes this to a patient, make sure you have the consent forms filled out for your patient before you give them this prescription. They need to understand that they cannot operate any kind of machinery, including driving, and that they need a driver to and from the dental office. We have Prevident toothpaste, methocarbamol. We have chlorhexidine, which is a mouth rinse. Clindamycin we typically give out if they are allergic to like amoxicillin, penicillin, all the cillins. Do they need a pre-med? So just make sure you're check marking off of the prescriptions that are needed. This area is where you are going to write all of your clinical notes. So let's say that your patient actually came in for a limited exam and they said that they were having throbbing and swelling and pain, and it hurts to chew, it hurts with cold. So after you are done talking with your patient, when you first sit them down, you're going to write down everything that they are telling you, their symptoms, how long it's been hurting, when does it mostly hurt, does it hurt to chew, does it hurt when it's cold, all that kind of stuff. And then your doctor is going to come in and run some tests. So they'll probably run like percussion, compression, and a cold test, especially when the symptoms are super severe. So let's say that they do a percussion test first. Percussion is when they're tapping on the teeth. You'll notice this. So make sure we write down which tooth is bothering them and then what tooth we're testing. So let's say it's tooth number 14 and it's not even hurting to the tapping. So we'll write down negative or we'll write down normal. Now let's say that they do a compression test where they're biting down on a cotton roll or on a bite stick, and it's hurting them and it's very uncomfortable for them to even bite on that side. We'll put down 2+ signs because it's not super severe, but it's not normal. Now let's say that the cold test sends them through the roof. You'll see us use endo ice or air for that. If it sends them through the roof, 3+ signs. This is very important, especially when it comes to writing your own notes. Referring to what I said earlier, write down anything that the patient had said to you in the beginning, like throbbing for 3 days, can't sleep due to the pain, and then we'll write down any of the prescriptions that we had given them physically, so amoxicillin 875 for 7 days. Sometimes, if we're unsure if they need a root canal or not, we'll give them a referral, or we'll say if patient calls back still in pain, schedule 14 RCT CRBU for 12 units, or something along the lines of that, so that the front desk can put it in with a note. So if they do call back, we can see that. Now, let's just take a step back and look at everything that we have written down so far. All of this is going to be put in your notes, okay? So let's say we did the procedure today and you noticed the amount of anesthetic that was used in the procedure. Make sure you check it off. So let's say we used septo and carbo, and we used like 3 carps, 2 septo and 1 carbo. Make sure you specify. Did we infiltrate? Infiltrate means you numbed right next to the tooth. A mandibular block means that we numbed into the mandible or the lower jaw. And lastly, a premolar block is where we numb into the mental foramen, which blocks off the premolars to the incisors. It could also be called an incisive block as well. Now let's say we were doing the bridge. So if we were doing the bridge and they had the tooth extracted before, ask them when they had their tooth extracted. And if we actually did the extraction in office, just look up the date on which we did it. If it hasn't been extracted yet, just do same day on the date of extraction, or write down today's date. Now let's say that the patient is having a crown done instead. Is the crown initial, which means they've never had a crown placed on this tooth before, or is it a replacement? So if it is a replacement crown on the specified tooth, make sure we write down the age of the crown, and most of the time your patient is not going to know exactly when they had the crown done. So try to prompt them into telling you. So ask them, has it been more than 5 years? Has it been more than 8 years? Has it been more than 10? And typically they're like, oh yeah, it's around 15 years old or whatever. Having them tell us this information will let us know whether or not their new crown is going to be covered. So let's say that their crown is a replacement and it's 20 years old. So we would write that down here. Now, is the crown broken? Is it unserviceable? Like, is there recurrent decay under it? Or did they lose their crown? We've seen it all, so it happens. Now above that we have shade selection. So this is where I typically fill out the color of the new crown. So is it A2, A1, B1? It all depends on what you had chosen during the appointment. So make sure that we select that shade, or write the other shade if it's not already printed in this area. And then I always go back up to the clinical notes and I write down shade A2, whatever shade that I had chosen. Here is the space for front desk initials, which you do not need to really worry too much about, as well as the box to the left that says admin. We're not writing in that. That's for the front desk as well. And this is basically what it looks like after you have everything completed. Again, this is an example of a extensive treatment planned type of route slip. As I start to show you how to set up rooms for certain procedures, I will also have the route slip that corresponds with that and what it should kind of look like after you have completed the procedure. So don't worry, you don't have to memorize all of this. I will continuously remind you how to fill out a route slip throughout these training videos. I know this was a longer video and it's a lot of information. So again, if you have any questions, ask me, ask a team member. We would be more than happy to help you get accustomed to this. Again, this is how to really communicate efficiently with the front desk from the clinical side of things, and it just makes things go a lot smoother. So thank you so much for watching again, and yeah.